Good afternoon and good morning. This is the 1537th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Professor Dr. B.D. Patel. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over from 7:30 to 8:30, the Hindi session, and from say 8:30 to 9:30, the international session in English, and from 9:30 to 10:30, local language session in Malayalam. We are uploading the videos of every presentation on the very next day itself, so that those who missed the presentation can watch it again and you can share it with your friends and without paying a penny. That is the speciality of our homeopathic International Forum for Promoting Homeopathy. And as you all know that today our guest is Professor Dr. B.D. Patel. And sir has completed BSc and MD in homeopathy and post-graduation in rehabilitation technique from Mumbai. He was the former principal, Government Homeopathic Medical College Hospital, Bangalore and Chandigarh, and is the former director and dean, VM Homeopathic Medical Hospital, Salem, and sir runs 2 clinics in Jayanagar and Halimulwa, Bangalore Road, Bangalore, and these 2 clinics are going in a good way, and he has been teaching medical practice for the last 50 years and more than 50 years, I must say. He has been into the corporate training specialty, especially for youth, former chairman, board of studies, KPSC member, advisory committee member, IS public speaker in various forms of and various subjects also. He's a Rotarian since 1990 and held many portfolios, served as Rotary as the best president AG in and is a zonal general also. He's the director of many avenues, outstanding district director for youth member Rotary Club of Junction, and trained many students in RYLA program, speaker on spiritual subject also. He speaks more than 16 languages, particularly the one of importance is the Sanskrit. Recently received Aditya Ratna from NTR 100th Birthday Celebration Committee, received many awards in the name of excellent service to homeopathy by Research Society India, Dr. Hanuman Memorial National Award, Living Legend Award by Homeo Friends Bharatpur, Excellence in Homeopathy by Homeopathic Science Congress Society Uttarakhand, and Lifetime Achievement Award, Dr. Wilmer Shabi, India, many more. He's a partner of Karnataka Qualified Homeopathic Doctors Association, now dedicated life for treating patients and study of Vedas, Upanishad, and right interpretation of Upanishad in service of entire humanity, giving discourse in many organizations, Temple, Rotary, colleges, and youth associations. And sir has presented so many interesting and very important subjects in this forum earlier, and today another big subject coming. Nobody could thought such a subject because GITA and case taking, as we all know that case taking is an important element that will definitely cure the patient even without medicine for 50% if the well taken case is after. That's what we have to say. But how the Gita is connected with case taking? Let us see what our professor has to say. Welcome, sir.
Thank you. Thank you. Thank you. Am I audible?
Yes, sir.
Yes. See, the point happened, this point came up. I think, if I remember, I was talking in Prayag College. So somehow I said, see, the Hahnemann thoughts, ideas are very close to Indian philosophy. And then I quoted here and there all that. Then somebody said, "Sir, how can you correlate GITA and homeopathy?" So that gave me an idea. Why not we think about it? Let us see. We can do that. So then on that idea, I worked out, and we saw there are so many things which are very common, which can take from that. Let me start my presentation. Is it visible?
Yes, yes, sir.
Sorry, something happened.
Network seem to be.
No, there is some problem here. You count these figures carefully. $13 and $12. This is what happens in our homeopathic case taking. Now, when I am taking the case, I will be getting only few symptoms. But when an expert person like you take the case, you will be finding out some more and more new symptoms, which I will not be able to catch. That is the difficulty in every case. And we need to be very careful and very attentive in taking the case, examining the patient, and eliciting the symptoms. Now, this is a simple case I'm just showing there. Now, this is on 23rd October 2020. That is just before second attack of corona. This was the patient. This was the lady. You can see both the sides. And you can see this, that was on 23rd October. And this is on 24th November. And this is on 28th December.
ಕೌಸಲ್ಯ ನನ್ನ ಹೆಸರು ಕೌಸಲ್ಯ. ಹಿಂದೆ 1 month ಬ್ಯಾಕ್ ಫುಲ್ ಎಲ್ಲ ಪಿಂಪಲ್ಸ್ ಆಗಿ ಬ್ಲಡ್ ಬರ್ತಾ ಇತ್ತು, ಕ್ಯೂಸ್ ಎಲ್ಲ ಬರ್ತಾ ಇತ್ತು. ಬಟ್ ಹೆಂಗೆ ಅಂದರೆ ಅದು ನೋಡಿದವರೆಲ್ಲ ಒಂಥರ ಫೀಲಿಂಗ್ ಬೇರೆ ಇತ್ತು, ವಾಮಿಟ್ ಮಾಡ್ಕೊತಾರಲ್ಲ ನಂಗೆ ತೋರಿಸ್ತಾ ಇದ್ರು ಅವರೇ ಆ ಥರ. ಸೊ ತುಂಬ ಬೇಜಾರಾಗ್ತದೆ ನನಗೆ. ಬಟ್ ಹೋಮಿಯೋಪತಿಕ್ಕಿಂತ ನನಗೇನು ಸೈಡ್ ಎಫೆಕ್ಟ್ಸ್ ಇಲ್ಲ ಅಂತ ನಾನು ತುಂಬ ಜನ ಕೇಳಿದ್ದೀನಿ. ನಾನು ಫಸ್ಟ್ ಟೈಮ್ ನಾನು ಹೋಮಿಯೋಪತಿ ಟ್ರೈ ಮಾಡಿದ್ದು. ಪಿಂಪಲ್ಸು ಕೂಡ ಈ ಥರ ಆಗಿದೆ. ಪಿಂಪಲ್ಸ್ ಬೇರೆ ಏನು ಅಂತ ನನಗೆ ಗೊತ್ತಾಗ್ತಿರಲ್ಲ. ಫಸ್ಟ್ ಟೈಮ್ ನಾನು ಇಲ್ಲಿ ಟ್ರೈ ಮಾಡೋದು ತುಂಬ ಖುಷಿಯಾಗಿದ್ದೀನಿ. 2 ದಿನದಲ್ಲೇ ನನಗೆ ಗೊತ್ತಾಯಿತು ಪ್ರಾಬ್ಲಮ್ಸ್ ಏನಿದೆ. ಬ್ಲಡ್ ಬರೋದು, ಕ್ಯೂ ಬರೋದು 2 ದಿನದಲ್ಲೇ ನಿಂತೋಯ್ತು. 1 ವಾರದಲ್ಲಿ ಈ ಗುಳ್ಳೆಗಳೆಲ್ಲ ಹೋಗಿದೆ. ಸೊ ಇದುವರೆಗೂ ನನಗೆ ನೋವು ತುರ್ಕೆ ಏನೂ ಇಲ್ಲ. ಸೊ ಮತ್ತೆ ಕಂಟಿನ್ಯೂ ಮೆಡಿಸಿನ್ ಈ ಕಲೆಗಳಿಗೋಸ್ಕರ ಬಂದಿದ್ದೀನಿ. ಥ್ಯಾಂಕ್ ಯು.
Now this is what it is. 1 month back, what she said was 1 month back, there were pimples with blood and pus. Whoever saw me, their feeling was different. They were feeling like vomiting. I was feeling very disappointed. People told me that homeopathy has no side effects, so you go there. So I was doubtful whether they are pimples or something else and how I'll get relief. And actually, to tell you, I asked her, your age is 26 and all that, why you don't think of marrying? She said, how can I marry how can I marry? People don't even like to see my face, but they have a different feeling. And I attempted 2-3 times, people came and just they went away without even talking to me because seeing my face. So I'm not able to get any boy who could settle down with me. I'm so happy within 2 days I could make the difference. Plus bleeding has stopped. In a week, all the pimples have gone and there is no pain and itching. Friends, many of you might have done some wonderful cases than what I'm showing you. What I'm showing is this can happen. And how this can happen and what way we can do it, let us see how it is. Bhagavad Gita in the reference started in the beginning as a Moksha Shastra, means anybody for liberation, you read Bhagavad Gita. And then it became Dharma Shastra. Then today it is Jivana Shastra, to lead your life normally and happily with minimum problems. Follow Bhagavad Gita's writings and what they say. Now, case taking and approach to case taking homeopathy, the most toughest job in homeopathy is case taking, as all of us realize that. Bhagavad Gita guiding us in the treatment of patients. How? First adhyaya, that is first chapter, is Vishada Yoga. Vishada Yoga means person with a lot of suffering. He's in depression. He's coming. Arjuna expresses his problems and refuses to fight. He says, all are my brothers, uncles, grandparents, friends. How can I kill them? Etc. etc. Actually, he goes into depression, puts down his weapons and sits separately. This is the first chapter what Gita talks about. Now, this is how patients also come to us with a depression, desperation, and keep on complaining multiple problems for hours together. You see, especially in allopathic practice, it is different. But when they come to homeopathy, they say, sir, the patient, the doctor listens to us, let us talk. And they keep on talking, so many things. Sometimes they will talk even their personal problems, family problems. There is a depression, their desperation, suffering with so many problems, and they will express it to the doctor. When Arjuna expresses his mental state, Krishna just listens without disturbing, allows him to express all his anguish and drives him to the middle of the battlefield. Krishna listened to Arjuna completely. So let us also listen to the patient patiently without jumping to conclusion. This is the first thing we can learn. And this is what is being taught in homeopathy. Allow the patient to talk, express first. Let him express, don't disturb. And then you allow the attendants to tell. And then your physical examination, then your observation. All these things we need to follow, and that's what Krishna did with the Arjuna. He just simply listened. He just, whatever Arjuna said, he went on doing that, and later on he came and said something else. Many times we are restless, we judge and try to come to a conclusion, and we disturb the patients. He may lose the thread of his thoughts. For example, see, simple thing is, if you feel the patient is very restless and very anxious, some medicines come into your mind, like aconite, arsenic, and so many other remedies. And immediately you'll be thinking on those lines and try to get some symptoms which can help you to give the medicine, without even waiting for the patient to completely complete his case. And thirdly, there may be so many other reasons for all these symptoms which may not be base of that. So let us wait, let us not disturb the thought process of the patient when he's talking. The first lesson we can learn from Bhagavad Gita is listen patiently and calmly, quietly, without any conclusions before we examine the complete patient, which without coming to any medicine and all that. Let us wait and see. Ultimately, when we keep on listening, see, it happens more with the what you call students sitting in the OPD. Each symptom, they keep on getting one remedy. The patient says something else, immediately you change the remedy. And he says something else. Ultimately, the medicine will be entirely different when compared to the first medicine, what you thought of.
Look at the cute dog.
Have you seen some? Did you observe what it is? That person is eating a cake and having his dog. Suddenly the cake fell down and the person picked up the cake and started eating. The child and the lady who were looking at that, they have understood something else, which you can all imagine what they could be. So, judgment of patient without knowing the facts, generally we commit the mistake. Maybe I might have also done that. I am not saying I'm beyond that. So it can happen. So let us be very careful and not judge unless we know the complete thing. Second chapter, that is Adhyaya, Sankhya Yoga. Krishna explains what is life, the complications, and how to come out or reduce them and how to deal with the situation. Ultimately, Krishna makes Arjun to realize his weakness and reminds his duty. Let us make the patient understand the disease he is suffering, the stage he is in, how will the disease progress and its prognosis, so that he cooperates in the treatment. See, sometimes we need to explain to the patient. He may come with, so, sir, I'm having this, I'm having all the. You need to make him understand that what his problem, what he's expressing may not be same, may be different. And you can also explain how the disease is going to progress. And then what will progress? Will you be able to completely cure him? Or will it be only partial? Only some symptoms can go. Or we can give him some relief. May not be complete cure. Maybe sometimes complete cure. When you explain the patient properly in the way he understands, he will cooperate in the treatment and he will be with you for a long time. बुद्धि युक्तो जहाति ही उभे सुकृते दुष्कृते तस्माद् योगाय युज्यस्व योगः कर्मसु कौशलम. This is one shloka from second chapter, 50th one. What does it mean? When a man attains the pure realization of life, he utilizes every situation and his expertise to give the best results. He may make negative things to give positive results. As we do in homeopathy, laxacy is a deadly poison and we have converted it to life-saving drug. So when you understand the life and you understand clear understanding, the negative situation also you can convert into positive. That is the efficiency of the person. So let us use our case-taking skills to the utmost, eliciting and the indicative symptoms, PQRS, etc., selecting the right medicine and right potency. This is our skill. This is what is called karmasu kaushalam. In the most difficult case also, you are able to take out some symptoms which are guiding you to some drug, and with your judgment, you are giving the right potency, the patient will be helped and he will be much better when he came to you and after that. Without involving ourselves in the emotions of the. This is what I want to tell you, because maybe I have experienced this in the beginning of my practice. When a patient, I'm talking of 48 to 50 years back when it started, when a patient used to come and express his problems and all that, and sometimes they are emotional, and there's emotional problems also. Then most of us try to get into their emotions and feel, yeah, that man is really suffering. If I would have been in their position, what would have happened? All these things thought come. So the first duty, what Bhagavad Gita talks is, do your duty, help them, everybody, whatever it is, but without getting involved emotionally with them, without having attachment with them. And the best thing is that when you get involved, in that, you will not be able to judge and give the right medicine. When you are out of that, then only you will be able to give correct medicine and take out the case properly. Now can we find out 9 hidden images in this image? This is what you do in the eliciting the case. Eliciting the, whoever is able to do it, you can put the number in the chat box. And our Dr. Dinesh will tell us how many people have done that. Just keep on looking properly, take 30 more seconds and find out how many figures are there. How many images are there in this? Anybody, Rameshji, Dineshji, anybody putting it in the chat box?
No, so far no one.
Just let them see it properly and put how many images are there you can make out. Some people are there in the chat box, 11 people. See, I could do only 7 to 8 images. Anybody could make out 9?
No, 6, 4.
So this is what it is, case taking.
7.
Yeah, 7, yeah, exactly. But actually there are 9 things. If you can just see very, very, very carefully, this is what is case taking, and this is what is observing, and this is what is your efficiency. Karma su kaushalam is this. Anyhow, keep on thinking on this. We'll go to the next slide. Yada yada, there is one very famous shloka which everybody quotes. Yada yada hai dharmasya glanir bhavati bharata abhyudhanam adharmasya tadatmanam sujamyaham. What does it mean? Whenever there is a decline of righteousness, O Bharata, and a rise in unrighteousness, then I manifest myself. That means I am going to come and help and see that everything becomes normal. So this is what people interpret it as, so there's something, all wrong things are happening in the world. So Krishna will come down and help me. This is the wrong understanding of that shloka. Krishna will not come directly in the form we imagine. He is within us and guides us. It is for us to take action in every situation. Nobody is going to come down from the sky. All the energies are with us. We need to utilize, we need to take the first step and then work on that. Krishna never shot, many people may not realize this. Krishna never shot a single arrow in the war, but has been guiding and protecting Pandavas till they won the battle. He is only guiding us. He is only giving us the way, how we have to travel. We need to take the first step. We need to travel on that. So this is what it is. Body has the capacity to fight all the diseases by itself. But when the disease force is stronger than immunity of the body, homeopathy comes to its rescue by stimulating the right strings, increasing its immunity to fight the disease. And this is what Hahnemann said. And what medicine we give, as I told in the beginning, they are sub physiological doses. And it will not even affect one cell, but it works dynamically by stimulating, making strong the immune system, the body's fighting mechanism. So body fights, not the medicine. So the body fights the disease with the help of our medicines. Unlike allopathy, where the drug directly acts on the disease parts and leaves its side effects. Why our medicines don't have side effects is this is the way. Because our medicines work at sub physiological level, at immune level, at defense mechanism, and not directly on the cell or on the tissue. The body itself fights, so there are no side effects. Can you believe who is this man? Anybody putting in the chat box? Have you seen the expertness? He is not using a bat. He is using a fighting stick. And is so accurate, so expert. Can we all be like that? Can we try to be like that? We should. Each homeopathy should try to accurately select the medicine with the potency. It may not be possible 100%, but let us try. Let us keep this person in mind and say, when he can do, why not we? Let us try. Now, along with this, you need to guide them for the food, other things. Yukta hara viharasya yukta cheshtasya karmasu yukta sapnava bodhasya yogo bhavati dukhaha. This is one, this thing where it says, 6th adhyaya, advising on food and exercise. It is a must in all cases, in all diseases. Advising on food and exercise is given in 6th chapter, 6th and 17th chapter. Food is always an essential part of any treatment, so also exercise. That shloka says, if you take proper food, what is needed by you and what is advised by the doctor, and the amount of physical labor which body permits, and then the amount of sleep only which you need. If you do all these three things, many of the diseases do not come and they are away from you. So along with your treatment, along with your selection of the medicine, you need to do this also. You need to advise every patient on food and his physical activity and movement. It will give 17th chapter gives 3 types of food: sattvic, rajasic, and tamasic. Sattvic is light food, vegetarian food, not with much of spices. Rajasic has some spices and some non-veg, veg, everything, which gives you a lot of strength and force. Tamasic is where you drink too much, you eat a lot of non-veg, don't work, and then the body becomes dull. So 3 types of food are there. In that, if you go through that, a lot of things are given. Let us all study Bhagavad Gita as a guide to our treatment, not on anything else. Diet plan, what to take, what to avoid, and how much to do exercise, etc. Everything is given in those chapters. Now, Krishna, after all these things, showed Vishwarupa to tell Arjuna that he is in the knowledge of everything and everything is happening according to him. Krishna tells, do your duty as I tell you. You have confidence in me and I am there, trust me. This is 11th adhyaya. He says, he has to get confidence from Arjuna. He has to show his real shape, real form, that everything, whatever is happening, is in the knowledge of Krishna. And whatever is happening, it is happening according to his own ideas and his own way. So trust me, what I'm telling, and do it. This is what he tells very strongly. So patient is always in doubt whether he will be cured or not, how long it takes. We need to assure the patient that we understand the disease, explain the line of treatment, and assure him we are, we are there to help him. See, when we have come across some of the doctors, they themselves are not sure about the disease part and the cure part, and they themselves, when they are doubtful, patient will not have confidence. Patient should have very strong confidence in the doctor. Yes, the doctor knows. So you must create that. As a Krishna created a confidence in Arjuna, so you must create. I know the disease what you are suffering with. I know how it's going to progress. I know where to stop it, and I know how to bring it back as far as possible. May not be completely reversed, but definitely some. See, some cases, especially the mental and psychological cases, are there where the patient keeps on coming back to original and going back and says, what sir, so many times I have, sometimes I feel better, and again comes. You must be able to explain them. It happens. There are so many factors. For example, a lot of mental cases are disturbed during new moon phase and full moon phase. The moment full moon phases come, some people are become over anxious, and so many problems they come and tell you. But as a doctor, you must know and must explain. Just wait, take the medicine. After 3-4 days, you'll be all right. Because after 3-4 days, the moon phase starts changing. So that also helps. So you must have all this and build confidence in the patient. Another one, krodhat bhavati sammoha, sammohat smriti vibhramaha, smriti bhramshat buddhinasho, buddhinashat pranashyati. This is in the second chapter, 63rd shloka. What does it mean? Anger induces delusion. Delusion causes a loss of memory. Through loss of memory, reasoning is shattered, and loss of reason leads to many mistakes and may end in damage or destruction. Now, if you go through the physiology of anger and its effects, 100% it suits this shloka. Thousands and thousands of years back, Indians knew many things in medicine. Now, see, I was really shocked when I first read this and when I tried to understand. It's a fact. Anger induces delusion. When you get angry, you do not know what you are talking, what you are seeing, who is in front of you. Delusion causes a loss of memory. You may speak whatever you want. You may speak whatever may not be relevant. And through loss of memory, reasoning is shattered. You are not even, and then loss of reason leads to many things, many mistakes, and may end in damage. See, in anger, you have seen many people, they throw things away and they, what you call, throw away the mobile, which is 1 lakh, 2 lakhs. It's the effect of anger. And you are not sure, you are not confident, you are not sure what you are doing. And you may do anything. You may hit the person, you may hit the children, you may hit your wife, or you may hit the husband. So this is what happens in anger. Anger is one thing which all of us realize, one of the main reasons for many, many problems, whether it is medical, physical, or social, or economical. Doctor to have patience in handling the difficult patients. There are many patients, difficult. Sir, 1 year, sir, no improvement, sir. Yes, you know what is the disease. And deal with them peacefully when the patients don't cooperate, or his attendants interfere in the treatment or irritate us. Many times this happens, the father or mother or the relatives come and say, what sir, what are you doing sir? So many things happen. They may irritate you. They may not cooperate. At that time, let us maintain our patience, our knowledge from Bhagavad Gita that all anger always leads to disaster. So let us not do that. Let us wait. And even if the patient wants to discontinue the medicine, you must be prepared to leave him peacefully so that next time he may come again and he may take treatment from you. You keep that margin. There's a saying in Urdu, दुश्मनी करो तो इतनी हद तक करो, कुछ गुंजाइश छोड़ो, जब दोस्ती हो तो शर्मिंदगी ना हो. That means you can have any differences with anyone, any of your friends, but keep that link. When he comes back, you should not be shameful of your friendship, your enmity, and you can become friends. So doctor needs to have maximum amount of patience, and anger should be minimum. He may be angry at home, he may be angry at his family, but never ever show the anger with the patients. We have seen many doctors, they sometimes shout the patient, or sometimes they very badly misbehave. Third adhyaya, the third chapter says, deals with the karma siddhanta. Whatever actions we do, the results will be accordingly. Here, see, karma means what actions you do, you will get the same result back. It depends. Your results depend upon your actions. Patient's response depends on similum we select. First of all, from our side, followed by how much they follow our advice in diet, exercise, emotions, etc. You may tell them, you may advise them how to control the emotions, how to not pay attention to certain things, and how not to bother about other things, and what to eat, what not to eat, how to stop drinking, how to stop smoking. Unless they follow this, you cannot expect 100% results. Many people come and tell, sir, you don't talk all this. You give some medicine, sir, I should be all right. Then I tell them, medicine alone cannot cure all diseases and all conditions. There are so many things you need to make. You need to make change in your lifestyle. You need to make change in your thinking process. You need to make change in dealing with the people. You need to make change how you treat your family. And you may love chicken, mutton, prawns, everything very well. But when it doesn't suit your body, you should not eat them. You should leave it. And more today, what is the most biggest problem is every film you see, any language you see, drinking is one scene there. Either heroes drink, heroes drink, everything. In our younger age time, drinking and smoking means only villains used to do that. Now, hero and hero's family, all ladies, everybody drinks. So that is, we need to advise them to stop it. Unless they follow our instructions, and of course, our medicine selection is correct, the results will not depend on what you expect. Arjuna says in the end, Nashto moha srutir labdha tat prasadanma yachyata sthosmi gata samdeha karishe vachanam tava. What does it mean? It means my confusion is gone. I am clear in my thoughts and I will follow your advice. This is what Arjuna says at the end. After the consultation, the patient must be free from all his doubts, develop confidence in doctor, and should feel the doctor will do whatever best possible for me, should go out with a positive note. See, the first sitting or first meeting, whatever you call, case taking itself is, as somebody said, half cured. Case is half cured if you take the case properly. Then you sit with them, then you advise them, then you talk to them, then build up a confidence in the patient. And confidence will not come just with your vague knowledge, but we should have a deep knowledge. Then the patient will feel, yes, sir knows everything and sir is going to help me out from this. He goes with a positive note. When the patient goes with a positive note, whether he takes, automatically things start working positively in his body and mind. Karmanyevadhikariste ma phaleshu kadachana. Ma karma phala heturubhu mato sangoshti akarmani. This is one of the very famous shlokas which most of the people on management, and they talk on this when they conduct what you call management courses, classes, and training the corporates, they talk on this. What does it mean? Treat the patient with all your skills and sincerity, but the result may not be as you expect, as there are so many factors working depending upon the stage of the disease, age factor, exciting factors, etc., which are beyond your control. That shouldn't deter you to do your best. Now, this is what it happens. many times, many factors will be there, and it doesn't work. For example, a patient who's working for a lot of time and then late night working and all that, and then he expects 100% result, it may not happen because you're disturbing the sleep. It may be financial factor which makes him to do that, or maybe anything else. And you see now, just now before this my class started by 7:30 or 7:45, one patient came, which I am treating with for last 5-6 years. He comes only when there is a problem. He is one who has an angioneurotic edema. The moment he eats out bakery items or takes any allopathic tablet for any condition, entire face swells up. So we have been advising him for the last 5 years, but don't eat junk food. Don't eat outside food. Don't take medicine. You just come to us, take our help. If not, then we will tell you what to do. But he doesn't follow that. And that exciting fact, today he was having some constipation issues. He took some tablet. The boy is hardly 12 years. And the face is swollen and everything but angioedema, full swollen with a lot of itching and maybe breathing problem also. So all these things are there. So without attachment, you treat the patient with the best of your factor, best of your knowledge, best of your efficiency, and the results always depend upon so many factors which may not be under your control. And this is what that shloka says. Just because I'm not able to help, I'm a bad doctor or I don't anything, don't feel that. You are doing your best, whatever knowledge you have, whatever this you got it, all that you are using it. But sometimes the results may not happen. See, you expect a cancer patient to survive forever? No, it doesn't happen. Though you may be giving the right medicine. See, I'll tell you, we had one more patient who was having lung cancer, and every week that case is live with me, and I have videos of that patient where the lady was going every week to the hospital for draining of the fluid from the lungs. Then when she came, after 2 months, I asked, how many times you went? Sir, after taking your treatment, I never went to the hospital. Okay. And then the worst part is, she had corona in between. And imagine a lung cancer patient having corona. And she came out of that, she said, sir, you give the medicine. I'm not going to take any vaccine or anything else. You give the medicine. I said, you'll die. I said, if I die, I'll die in your hands. No problem. That lady came out. But after what life expectancy, the hospital people gave us 3 months. She survived for 4.5 years. And so whatever is possible that can be done, don't expect that you are a god and you will totally reverse all the cases. It's not possible. So without attachment, you use all your energy, expertise, and then treat the patient. Now, there is a book, we have seen that, Bhagavad Gita, a psychology tool. Entire counseling techniques in every angle by Bhagavan Krishna did for Arjun 1000 years before. This is a big book on this, and Nimhans Hospital is working on this. Nimhans is a National Institute of Mental Health Sciences in Bangalore, and it is working. And there are so many points which we can take from how to treat mental diseases, mental sicknesses, emotional sicknesses from this. So friends, we have seen how Bhagavad Gita can be utilized in treating the patients. Now it is for us to make the best use of our Gita Gyan in helping the suffering humanity. So this is my last slide. So other presentations are like this. So many things are there. Whatever it is, we can do it. Many more. And this is my number. Please note down, take my email ID. If you have any questions now or after, you can just tell me, you can send me the mail, I'll answer, you can call me on the phone, I'll answer. With this, I close it. Thank you. Thank you, friends. I'm stopping. Yeah. I told you it's only 40 minutes. So I'm going to close in 40 minutes. Now, any questions, anything, any doubts, you can please.
Yes, sir. Really, a very good session indeed. Because you are really able to connect between this case taking and Gita in a beautiful way. And that's beauty of your presentation. As you rightly point out, when you take the case in details, and there are some, as in the first picture, there were we told people in the beginning, but all in all, there were 13% by magic. And the 13th person is none other than the so-called God.
So it was no magic. It was a medicine which helped them. That's it.
Yes, the medicine in the way of God.
Yes.
The physician in the way of God. I must say, which is right, sir. Which is right, where the medicine is the 13th person or the
Yes.
physician is the 13th person,
Exactly.
acting as a God.
Yeah.
Yes, I invite Dr. Manoj to say a few words on this presentation because he's a person who has very good knowledge in this Gita and everything. And yes.
Yeah.
Thank you, Dr. Ganesh. A nice presentation by Dr. Patel.
Sir, your voice is less. Manoji, increase your
Yes,
volume.
sir, yes. But what is the problem is that
Yeah.
common man is not at all able to understand. So that is why Arjuna, Krishna told, "Na buddhivedan janayet, na ajnanam karma sanginam,
Exactly.
doshe sarva karmani vidyanita samadaran."
So
So
nice.
that's the problem. Everybody can't digest this. Just like homeopathy, Dr. S. Radhakrishnan can digest this.
Yeah.
Einstein can digest homeopathy. Mahatma Gandhi can digest homeopathy. Rabindranath Tagore can digest homeopathy. But the common man, not the common, the medical theorists, they can't understand.
Exactly.
That is the basic problem. But however, this type of presentation will open the eyes of the common man or the scientist. Just what happened to Oppenheimer when he saw the explosion of the atom bomb. Divi Sahasrara Surya, just like that, thousands of sun, the atmosphere.
Exactly.
That much. He's a scientist, he's a physicist.
Yeah.
But he can understand. Then again, there's a clause is given that Idide Jnana Makyadam Guhyat Guhyam Vimir said that you can do according to your wishes.
Yes.
That is the freedom the Indian philosophy is given. Moreover, the homeopathy has also got such provision because of the elasticity of nature's law. Those who are following the Kendian method, those who are on the Dudgeon's, this Richard Hughes method, now the Prabhakar method, everybody is getting results. But whether it's a cure or not is another thing. But whatever may be, the patient gives some sort of solace through these methods.
Sir,
all this happens because moreover, another thing is that Hanuman never claims that he is the doer of all these
ultimate,
things. Yes. Agarma in karma. That is Hanuman says. God permitted me within the time to space to discover all this cause of chronic disease. It's a gift, God's gift. Then the medicinal proving is an act of revelation. It is an aphorism. But only those who are reached to such a level can perceive it. Thank you, sir.
There are so many other points, other shlokas, which I have not touched because of time. And see, generally, I have seen many people, they keep Bhagavad Gita in the puja room with all red cloth and do all puja. And I tell them, when you do this, Krishna is breaking his head. He said, you are doing puja of the book. No, read it, open it, read it, and use it in your life. Bhagavad Gita is for your life and your betterment, how to live, not to do puja. Puja is okay, it's okay for some extent, but you need, let us open it and see how it can be useful to us in our daily life, in our medical practice, in our handling of the business and everything. This is what I want to say. And you said one wonderful shloka, that is 18th chapter, 63rd shloka, where he says, I have told you everything in the life, in the world, what you have to do.
The secrets
Now it's for you to understand, question, re-question, examine, and then if you are convinced, then you accept and follow it. This is what is you said, sir.
Yes.
Guhyataram Jnanam. So that is what it is. So everything is there. Only we need to utilize those things for our practice and our life. Anybody else wants to say anything else? Please. Thank you, Dr. Manojji. I think Dr. Dhanesh has selected a right person for this session. Yes, Dhaneshji, I thank you also.
Yes, exactly. Exactly. There is another person coming,
Yeah,
none other than Dr. Remadevi Ambadi.
yeah,
She's
yeah.
and the same kind of knowledge.
Yeah.
He is the rank holder in MA Sanskrit rank holder, Dr. Ramadevi Ambadi.
Voice is less.
Then maybe network problem.
Yeah.
Ambadi, Doctor, can you say a few words on this presentation? Can you add anything more to this session?
Yes, she is
You
responding
hear
now.
me?
Yes, yes.
Yeah.
Sir, Patel sir, it was a very nice presentation.
Uh,
And see, you have connected so many points in Bhagavad Gita to our practice.
yes.
See, there is one word, no? Atmeva Atmano Bindhu, Atmeva Ruburatmana, Atmeva Uddhared Atmana Atmana, Na Atmana Avsariyad.
Yes.
Yeah, we only want to think whether we should do it or not.
Exactly. See,
We only can do it.
yeah.
So if you are trying, we can do it.
Yes. I did not use very complicated shlokas because many of them may not understand. So I said only the main important I used and whatever it is. And Dr. Ramadevi Ambadi is a very knowledgeable lady and experienced
goodness.
lady, very nice like Dr. Manoj. Rightly, you picked up Dr. Dhanesh. I should thank you. Once
Okay,
again.
thank
Yeah.
you, sir. It's a very nice presentation. Please come again with all these points.
Thank you.
Sir, what is the present situation in Bangalore? Because there are a lot of cases of chikungunya is going on.
Chikungunya and dengue, plenty of the cases are there, which starts with the fever for 1 day, 2 day, 99 and 100, below 100, and then immediately you have a lot of body pains and so many things are coming up. And many times the dengue, when you send for blood test, it is serum negative. Sometimes they are false positive, sometimes serum negative. But when you treat with your own, homeopathic ideology, homeopathic principles, they respond. But there are many cases very happening. And because of the weather, which we did not expect, suddenly rain, suddenly heat, suddenly sun, and pollution, number one in India is Bengaluru.
Yes,
Can you find out specific remedy as preventive for chikungunya as well as dengue?
Ambediji, can you ask a specific remedy?
No, if you are having some 100 of patients, we can anyone himself says no.
Yeah, there are 4 or 5 medicines which are commonly indicated in Bengal weather. Number one,
that is what I am asking.
Epitorium perfoliatum, Rustox, Bryonia, Dulcamara, Causticum, and then sulfur. Sulfur is one we prescribe quite often to remove the blockage in the treatment in the beginning, and then we give the indicated medicine. And 80 to 90% they work, 100% they work. So only thing, a few symptoms we take up, and then it works. On some cases, yeah, tell me.
My daughter is there in Bangalore. She is practicing there, and she had herself had this chikungunya. She didn't take any preventive. Then she was telling her pain was so severe, and I had told her to take medicines and all. Then now she was telling only after taking causticum she is getting better.
You see. Dr. Ramadevi, can you ask her to be in touch with us? We have an organization with she can come, present paper, be with us every month once.
She is in touch with you, Doctor. Her name is Dr. Asha B. Varghese.
I shall share the number, sir.
She is IFMA president there.
Okay, okay. You please send her name and phone number.
I
We'll
shall-
just be in touch with her.
I
Okay.
will ask her, I will tell her to contact you,
Yeah,
sir.
please, please, please. So
Okay,
nice. So nice.
she will contact you.
So
Okay.
nice.
Okay,
Nice.
sir.
Okay, sir. Okay, thank you.
Right.
Anyway, if anyone want to have a question or anyone want to add anything more to the session, please raise your hand so that we will allow you to unmute yourself and you can talk to Professor B.D. Patel, sir. Yes, hope somebody may come up with any question. Please raise if you have any doubt, if you want to add anything more. Because then only our discussion will be in a very good way. Fortunately, nobody is responding. Sir, what is your experience in colleges? Whether the students, how many students of you become famous doctors as far as your observation?
I think especially in Bangalore, in Punjab, everybody is doing very well. In Bangalore, we have one doctor, Dr. H.L. Swami, is one of my first students and doing extremely well. One of my students is Prashant. What do you call not Prashant? He's a professor in the college. Of course, who are teaching in my government college, most of them are my students. Even the present principal is my student. They are doing extremely well. And in homeopathy in Bangalore, most of them are doing very well when compared to other professions and other colleagues. Then some may not be able to establish, but many of them establish themselves. And minimum, I'm talking openly, minimum, we say the practice is not at all good. 1.5 lakhs per month is easily they are making. Whose practice is not good?
Yeah.
Okay. Imagine now, a software fellow gets 20,000, 30,000, 40,000, 50,000, and 24 hours he has to work. But here people are there, very well established, very nice. And most of them, I see most of my students are established and they are doing homeopathy. See, there is one problem with many of the North Indian colleges or even North Karnataka. They have homeopathic degree, but they never practice homeopathy. They practice unadulterated allopathy. They don't even have homeopathic medicine in their clinic. But in Bangalore, we have seen most of them practice homeopathy. Some may practice single medicine, some may practice 2-3 medicines. That is a different issue. But most of them are surviving and doing very well, extremely well. So thank you, everyone. Thank you, Dhanesh ji, for giving me opportunity and being with us. So thank you, especially Dr. Rema Devi ji, and special thanks to Dr. Manoj for quoting all the Gita shlokas which I wanted to quote. You have quoted. So nice. Thank you. Thank you very much. Thank you and all. And
Thank you,
special
sir.
thanks to my
Thank you,
Dr.
thank you, sir.
Prashant.
Now I invite Dr. Manoj to say a few words as well as the vote of thanks to the session.
Yes.
Manoj, also there's some network issue may be there.
Yes. So
Yes.
the next presentation, you always must meditate and reflect on all these philosophical, because we know the Kshetra, Kshetratnya, Bhaga Yoga. Homeopathy concerned, this is Kshetratnya and the body is Kshetra. The instrument for the higher purpose of the existence, the human body. So on behalf of IFPH, I am expressing sincere thanks to Dr. B.D., Dr. Patel, and all those participating in the session. Thank you.
So thank you and Shubharatri.
Thank you, Dr. Manoj, and thank you, Professor Patel sir, and those who attend the session.
Yes. Thank you. Good night. Shubharatri.
Tomorrow, we will have a session from Dr. Suvarna Rajesh Kale, and she is an associate professor, Department of Gynecology and Obstetrics, Srimati KB Abad Homeopathic Medical College, Naushik, and we'll be discussing about postpartum hemorrhage and its homeopathic management. Thank you all. Good night.